Good evening, everyone. Welcome to the latest edition of Optima YouTube Live. So, this is a monthly meeting that we have where we get different experts and we discuss about common health issues. Basically, this is to increase awareness about certain health issues and also to address any questions or doubts that patients might have or even the general public might have. So, with respect to that, this session, we've decided to discuss about Pilates, and for that, we have Dr. Kushbu. Dr. Kushbu is a consultant physiotherapist who is here in Optima itself. So, welcome, Dr. Kushbu.
Thank you, sir.
So we can start off today's session, and while we'll be discussing about Pilates, anybody who is attending, please do ask your questions in between. We'll try to answer them uh, during the session. Uh, if there are any issues and we are not able to answer the questions, then definitely we will try to answer them in the comment section later on. So, starting off, what exactly is Pilates, Dr. Kishore?
Yes, sir. So I would like to explain about the Pilates. The Pilates is a form of exercise which was developed by the Joseph Pilate. So the Pilate have the major principle and which is focused on the four major principles. So the one is your control, the second is your breathing, the third is your body alignment, and the fourth is your core stability. So when we do the Pilates, these are the four major principles which works on this. So that means when I say the control, that means it's not about the how many repetitions of the exercise you do, but it's about how well you move. So that means like quality over the quantity. So that says by the control. So second we have is the breathing. So the breathing is like whenever we do the Pilates, it's really important that you do the normal breathing, which helps you to relax your muscles. And the third thing we have is a body alignment. So the body alignment is nothing but you're correcting your posture. So that means whenever we do the Pilates, there is a specific form of exercise which needs to perform in a specific way. So when you align your body in a specific way, that helps you to correct your posture. And the fourth and last thing we have is the core stability. So so whenever we do the Pilates, it's really important that you engage and stabilize your core, because the major concept is we work on the core muscles and the surrounding complete body exercises. So the core stability is the one of the main focus on while doing the Pilates. So again, the last I would say is like the Pilates is mainly, it's like it's not about how many repetitions you do, but how correct and how well you do it. So that is what has been said by the Joseph Pilate.
Okay, very interesting. So, basically, it consists of control, breathing, posture, and core, right?
Cool.
These are the
Yes,
four
sir.
principles. And all of these are incorporated into a single exercise. Otherwise,
Exercises.
usually,
Yeah.
like core exercises are different, and
Different.
then uh, breathing exercises, we usually do it different or we do it during meditation or
Yeah,
something.
so yes,
But
correct. So
here,
in Pilates, we will be including all these 4 points and then we will be doing the exercises. Yes, sir.
okay. So that's very interesting. But many times, like I've seen certain, for example, my own niece, she goes to some gym kind of place which also has Pilates. So what is the difference between that and clinical Pilates? What you do? What is the difference between both of them?
So yes, sir. So the Pilates, which when it's used for the rehabilitation and it's used for the therapy, like by the physiotherapist. So that is where it's a clinical Pilates. So the clinical Pilates is how different than the normal Pilates is, because its concept is like they focus on the individualized exercise. So like suppose take an example of the person who have the knee pain and the person who have the back pain, both of them can do the Pilates, but it will be different for the every individual, because it will be different based on their assessment. We will decide so what part and what area they have to work more. So depending on that, we will be deciding the exercise. And the main focus for the clinical Pilates is like movement pattern correction. So why we need to correct the movement pattern is, most of the time we think that the pain is coming because of the injury, but it's not. Most of the time the pain is coming from the poor posture and the poor movement pattern. That means lot of time we have the few muscles which are weak, the few muscles which are tight, so overcompensation, the overloading. So that's where the clinical pilates is different, because they do assessment, they design your personalized exercise, and that's where based on your need we will be putting you on for the pilates. So that's how it's different for than the normal pilates, because when we see the in the studios and the fitness areas and all, the people will be doing, a lot of people will be doing together group of exercises. So in that, irrespective of their pain, irrespective of their posture, they will be doing the same sort of exercise. But when it comes to the clinical pilates, we make based on the individual's need. So that's how the clinical pilates, I would say, it's a different, and it's modified, and it's like each patients can perform the pilates.
Okay, so here you're doing an individual assessment of each person, and you're designing the exercises according to that person's problem and according to that person's need.
Yeah,
Unlike, let's say, some fitness studio or something where it's some general exercise that everybody is doing as a group.
correct.
Eh,
Yes, sir.
Have I understood that correctly?
Correct, sir. Yeah.
Okay, so that's good. That's good. So, what would be, for example, if somebody is interested in Pilates, or if somebody is doing Pilates, let's say,
Yes, sir.
uh, would what situation would they be? Should they choose clinical Pilates instead of this kind of general Pilates?
Yes, sir. So I would say, what is a role for the physiotherapist? So in that case, let's take an example with the knee pain and the back pain. So the process will start with the assessment. So what is the assessment is, where we will check your joint mobility, how much your joint has movement, what is the stiffness you have, and second part is your muscular strength, and the whether your muscles are tight, whether your muscles are weak. So depends on that. Afterwards we will decide, yeah, okay, you need more of the stability exercise, whether you need more of flexibility exercise, or whether you need more of strength exercises. So all the conditions like your back pain, neck pain, shoulder, and the knee pain, even the post surgical patients, and irrespective of the postural issues also, so all these conditions can be treated with the pilates, or maybe it can add on, the pilates can add the progression of the exercises. So let's take example of the back pain. So when somebody have the back pain, so after doing the assessment, most of the time it says like, your core muscles are weak, your core is not the stability is very poor. So in that cases we will be working on their core stability exercises, their glute activations exercises when somebody have the knee pain. So for the knee pain, what we'll do is like we will check their hamstrings and the quadriceps ratios, and like whether the hamstring needs the flexibility or the quadriceps needs the strength. That means your front of thigh or the back of thigh muscles. So depending on that assessment, like your joint mobility, your muscle strength, and your flexibility, these are the major concept, major focus. And other than also we have the detailed assessment, and after that we choose the design, we design the specific exercise, including your strength training and the pilates both together. So yeah, that's how it's different than the doing a normal pilates.
Okay, that's very interesting. But like, which situation would you recommend Pilates or clinical Pilates in every patient with back pain, or which are the patients who would really benefit? Like, for example, if I am a patient who is having pain in a particular joint, or let's say I'm having back pain, what
Hmm.
is the situation in which I should consider clinical Pilates, or what is the situation in which you will suggest clinical Pilates to
Yeah,
that?
so that is what we will decide on your assessment. So like somebody have severe acute pain and the radiculopathy or the tingling numbness and all, in that case, the Pilates can be performed in even the mat also. So that when we do the mat exercise, the lot of like just lifting the leg straight, okay, the simple exercise, that also can be effective when I put the concept like control your movement, just breathe in, breathe out normally, and just do it with the core engagement. So even if the patients who have the back pain of severity of the back pain or the moderate back pain or the low less back pain also, everybody can do it because it's adaptable. So we start from the basics and as they improve their symptoms, we go forward with that. So like I would say the simple exercise, lifting the leg, bridging, and just tilting your pelvic. That means, like, a lot of time in low back pain we see the posture and the pelvic is tilted anteriorly. So that's where we try to make them understand what is the core, how your posture has to be. So I feel most of the time all the beginners and the pain patients and the any sort of athletes or the elderly, all the people I think can do the Pilates. But the what kind of the Pilates they have to choose, that's a different, like whether you have to go with the basic met reformer or for the fitness. So every individual's goal will decide that what kind of the Pilates is important.
Okay. So basically, any patient with back pain or any kind of
Thing.
shoulder injury or any other kind of injury will be assessed by you first, and based on that assessment and whatever you find in that assessment, you will suggest clinical Pilates to that patient. Is that
Yeah.
how it works?
Yes, sir.
Okay, okay. So you were mentioning about mat Pilates, so versus reformer Pilates. So what is that? What does those two things mean?
Yes, sir. So the mat Pilates is basically done on the floor using the yoga mat. So that is called mat Pilates. It's in a mat Pilates we mainly use the body weight. So it's like your own body weight we use to do the exercise. It's always easy to start when it comes to the mat Pilates, but when it comes to the reformer, you have to learn the little bit of the basic principles and how the exercise works, what are the different things and all. So the reformer Pilates is like a machine based Pilates. So we have the machine for that, where we use the different spring as an external resistance, and we have the different supports and the loops and the handles which controls and supports your movement. So that is called the reformer Pilates. So the I would say the reformer Pilates is a kind of a tool which we use it for to generate the external and the extra resistance and to progress on the more of the exercises. So that's how it's different on the mat versus the reformer Pilates. Yes.
Okay, so if I understood properly, mat Pilates is you just use a yoga mat and you use the body weight, and based
Yes.
on that, you do the exercises. Whereas
Exercise.
a reformer Pilates is actually a machine which has different resistance based on the strength or the this thing of the spring that you use, and based on that, you can change the intensity of the exercise or the Pilates.
Correct, sir.
Is that correct? Okay, okay. So while we are discussing this, of course, there are people who are putting in questions, and definitely we can answer them as we go along. So Raj is asking, what are the clinical markers which indicate that a patient is improving beyond just pain reduction? Meaning, I think what Raj is trying to ask is, how will you judge whether a patient is improving or not? Is it only based on whether the patient is feeling better, whether the pain is reducing, or are there other ways in which you can judge whether the patient is improving?
So yeah, there is always, as I explained before, also assessment. So when the physiotherapists are assessing, they have the MMT gradings, they have the flexibility scales, they have the spatial test. So that's where we decide, how much you are improving. Suppose your few tests were positive before starting the exercise. We again, after 3 weeks and the 4 weeks, we again do the reassessment whether your flexibility has improved, your strength has improved, whether your test has become negative or not. So there are the special tests which makes the diagnosis also, and which makes know how better you are and how much time it will take. So yeah, there are the so many other ways, like manual muscle testing test and the flexibility test, so which it's not about the physiotherapist are understanding, but even the patient can also understand by improvising their muscle strength. So if suppose I start from the lighter resistance or the 1 kg weight, but after the 3 to 4 weeks they are able to do like the 3 kg and the 5 kg of the weight. So that's where the patient also understand over the period and over the practice they have improvised their strength. So and other than that also we have the always a testing tool which says that whether you are improved or not, other than the pain.
Okay. So I hope that answered your question, Raj. Basically, from the patient perspective, just other than just pain reduction, they will also have an improvement in your strength and in your function, meaning in the strength, the power in your muscles, as well as how you're able to perform certain movements will improve. And that can be assessed by the physiotherapist using certain standardized scales like MMT, muscle testing can be done, and based on that, it can be assessed whether you have improved or not. So, Apurva is asking, how can a viewer get started with clinical Pilates at your center? So, Kushbu, if somebody wants to start clinical Pilates at Optima, how do they go about it? Can you
Yes,
tell
so
us
I
that?
would suggest if you are somebody who is having any pain or the postural or any sort of problem, just consult the physiotherapist. So they will guide you through the complete assessment and what is the requirement, and based on that you can decide, how many frequency, how many sessions, or whether you need to do at home. So we can plan your exercise where you can do it at home also, or if you would like to come here and do and get it trained by the experts, you can do that also. So I mean, the assessment says everything, what is the requirement, how you can go forward with this. And yeah, the basic all the questions I can answer to individual when it comes to, because the clinical pilates is again it's individual. So we can do it after consulting once.
Okay, so I hope that answers your question, Apurva. Basically, you need to take an appointment. The number, if you are not aware, is 998 0094600. So you can just take an appointment either at Dr. Kushbu or Dr. Shivraj. They are the consultant physiotherapists here in Optima, and they will assess you and guide you with respect to how to get started with the clinical Pilates. Sarita asks that when before prescribing Pilates, how do you differentiate between mechanical pain and movement dysfunction? So, do you need like is that something that you need to differentiate before starting Pilates?
So the
Can you ask the question once again, doctor?
Sure, sure. So Sarita is asking, how do you differentiate between mechanical pain and movement dysfunction before prescribing Pilates?
Yeah, so I would say, yeah, the assessment includes both the things. Whether your movement pattern is because, so the root cause we have to find out, right? Whether the pain is coming from the muscle weakness or the muscle tightness or the movement pattern. So as I gave example before, also the anterior pelvic tilt, using the one side of the hip more, using the one side of the body or standing one side of the more. So there are the so many. I would say the parameters are there to differentiate whether you have the mechanical pain or whether you have the movement pattern dysfunctions. So I would say in both the cases we can do the Pilates. If you have the mechanical pain also, you can join the Pilates. And if you have the movement dysfunction, so because the clinical Pilates major focus is to correct the movement pattern. So that is where also we can work on to get better on your quality of the movement.
Okay, so I hope that answers your question, Sarita. So basically, simple assessment by the physiotherapist will be able to tell the difference between mechanical pain and movement dysfunction. But in either cases, in both cases, whether it is mechanical pain or movement dysfunction, clinical Pilates, which are tailored to that individual problem, will be beneficial. Is that correct, Dr.
Correct,
Kushbu?
sir. Yeah.
Okay. So, Jeevan is asking how often should clinical Pilates be done? I think he's referring to the frequency. Like, what is clinical Pilates? How frequent is it done, or what is the frequency of the exercises or the sessions that need to be conducted?
Okay. So when you are doing the Met Pilates, I would suggest you can start with the 3 days a week for the 4 to 6 weeks. So initial period where you are learning the Pilates, where you are doing the body weight training, or you are using the reformer also, 3 days a week you can start with that, and slowly as you see improvement in your movement, the reduction in your pain, and you are getting better on your strength, you can reduce the frequency like twice a week or once a week. So ideally 2 to 3 times a week, something which is more benefits when it comes to the outcomes. You can see the larger outcomes when it's done for the 3 weeks and the 2 weeks in a week.
So I hope that answers your question. Pramila is asking an interesting question, which is what many of patients ask me also when I ask them to meet a physiotherapist. So she's asking, why should I choose guided sessions over just watching YouTube exercises and then imitating the YouTube exercises? So many patients whom I refer to meet a physiotherapist also ask the same question. So first, you please go ahead and tell me, Kushbu, how would you answer this question?
So the question is like, why can't they do the exercise by seeing the in a YouTube videos and
Correct.
researching the exercise, right? Okay, yeah. So that's what I would say. I have studied for the 5 to 7 years to just learn the biomechanics, to learn the the assessment, strength, and the entire special test to diagnose specific conditions. So when it comes to the diagnosis, it's really important that what is really giving you the pain. So why the pain is coming? Is it like n number of the reasons for that? So until unless you don't know why the pain is coming, doing the any sort of exercise, I don't think it gonna benefit you more, until unless there is a something which okay, this is my problem, this is where the pain is coming, this is what my body has adapted, or it's wrong something. That's why the physiotherapist guides you on that, and that's why the plan, the design, the exercises.
Yeah, so that's a very relevant information. The way I explain it, Pramila, the way I explain it to my patient and Kushbu, the way I explain it to my patients is that you can give a child or anyone a textbook, right? And tell them that you come after 1 year and write the exam, right? Or the person, even if they have the textbook, they can go daily to school and the teacher can teach them. So, in the later situation, when the child is going to school and the teacher is checking how they're reading, guiding them, and telling them to read this way or read that way, and this is where they're making a mistake, and to correct them, they're more likely to pass the exam at the end of 1 year than if you just give a textbook to a child and say, read and come and try to pass the exam. So, does that make sense? Is that a correct analogy that I give to my patients?
Yes. Yeah. I
So
mean, yes, it's
basically, yeah, I hope that
yeah,
that example helps to
understand.
explain to Pramila as well as other people that what is the utility of meeting a physiotherapist, because just like big athletes also, they can also watch YouTube videos and do
Do
exercises.
the
They
exercise.
have a coach and they pay them a lot of money, right? And the reason why they have a coach is all of us, all humans, we do better when we have somebody supervising us, checking how we are doing, and guiding us with respect to how to do it. That is why children go to school, that is why we go to college, and we have teachers. It's basically because we learn better when somebody is teaching us and supervising us and correcting us. So that is an important role, I think, that the physiotherapist plays with the human touch. And of course, as Dr. Kushbu also said, just seeing YouTube videos and doing exercises would be like self-diagnosing and taking some tablet just on your own, right? If you met a physiotherapist, they would have done a proper assessment and they would have made a proper diagnosis as to the exact type of exercise that you specifically need. So I hope that answers your question, Pramila. As we get questions, we will keep answering them. But in the meantime, you were speaking about mat versus reformer Pilates, and you said that mat Pilates is what you can be done just with the yoga mat using the body weight, whereas reformer Pilates is something where a machine is used.
Yes. Yes.
So this machine is something which is available in Optima. Am I right?
Correct, sir. So I would like to, show you the videos, like what kind of the exercise it is. Just the one single exercise which we are showing you, that how it's performed and what the core, mainly the Pilates works on the core stability, right? So I would like to see the viewers that, they can understand what is the Met Pilates and what is the reformer one. So can you share the Met Pilates video one? Yes.
Sure, sure. I have the video here. One second. This is the mat Pilates, right?
Correct, sir. So here, as you can see, the first, yeah. So the first, when the belt is moving, right? So that means like your arch, the back is arched where the core is not engaged, and the letter, as you can see, when he is trying to pull the belt, but it is not moving. I mean, the belt is not moving. That's where he engaged. He tilted the pelvic, and the core is activated. So this is how the Met Pilates works. So when you do it on Met, this is the one simple exercise where you can make a difference with the flat back and engaging your core muscles. Okay. The similarly we have the another video which where he performs the reformer exercises, the one exercise. Yeah, so this is the machine where we have the support on the bar and we have the different resistance, where here the automatically your the form of exercise is like that, where the spine is stabilized. It's already the core has engaged, and that's where you move your lower body and the upper body with stability of the core muscles. So this is again the one of just example of the exercise that there are so many other ways we do the exercise on this machine. So yeah, we do have it in Optima.
Okay. So yeah, so that was the difference between mat Pilates and reformer Pilates. So both of these type of exercises are equally beneficial. Where would you choose one over the other?
Yes, that's a very good. I think I would like to say this because the Met Pilate and the reformer, it's always depends on the individual's goal. Okay, let's say the person A who wants to just reduce the pain. For them, it's just the get rid of the pain is a goal. Where the second person who wanted to do the trekking, who want to go for the 1 hour of the walking, going for the more functional demanding activities, so that is what the person A and person B is goal. So I would say both the, it's not the reformer is something superior, but it's just the tool. When it comes to the more demanding functional training, that's where you use the external resistance and the kind of a form of exercises which helps you to build the better and the faster recovery and the, I mean, say, yeah, the quality of the movements. So both are as good as you can start doing in I mean, the beginner's level. But as your goal and your demand are increasing, that's where I think you can choose the reformer, which helps you to get faster recovery. But the both are good. There is nothing which the one has the better and the one has a lesser benefit.
Okay. So based on your goals and based on this thing, higher goals is you can choose the reformer Pilates,
Reformer,
right?
yes,
Okay. Now, when you were talking about Pilates in the beginning, you spoke about control, breathing, posture, and core movement.
yes,
Sorry, core
stability.
stability.
Okay.
So, what is the importance of all of these? Can you tell us a bit more about that?
So
Like,
I would say, I would like to say, as in a benefit of doing the Pilate. So in the benefits, what is the benefit when you do the Pilate? Mainly, it helps you to reducing your pain. That's the one part. With that, you improve in your posture. You enhance your muscle strength. You gain your muscle flexibility. You build your core stability. So that is, this is what the major concept like stability, control, and the strength is the major benefits when you do it the Pilate.
okay. And what is the importance of core versus movement control in Pilates?
Yeah, so the core is the one of the muscle which is not your abs, but it includes your pelvic floor, it includes your diaphragm, it includes your all around paraspinal muscles. So when the core stability is good, we will not overload or overdo for your neck or for your back. So that's what the spinal support will be majorly provided by the core muscles. So when you engage your core and when you do for the shoulder or for the knee also, it's benefited. I mean, it's in a more better control and the movement.
Okay.
Yeah.
So basically, when you engage the core, the uh, movement is better or the recovery is better? Can you just explain that again? I didn't understand
Yeah,
it.
so both the movement will be better because when you engage the control, sorry, when you engage your core, and the recovery is, I'm not saying by engaging your core only the recovery will happen. Recovery depends on the lot of other part also. So the recovery is depends on your symptoms and all, but when specifically it when the poor control on the core is a problem, that's where you recover faster if you engage your core. But yeah, it makes better your movement and your control.
Okay. So that was very informative. I think. we started off with learning about the four components of Pilates and the basic principles of Pilates. We understood about which is why clinical Pilates is much better than the general Pilates, which is being done in a uh, fitness studio or some other place or a gym like that, and how a physiotherapist uses Pilates, both either a mat Pilates or using a particular machine with different springs which offer different resistance, which is called a reformer Pilates, and how these can help people with different goals to achieve those goals, which not only with respect to treating any problem or pain that they might have, but also to improve their movement and improve their strength and function, so that even if they want to do certain strenuous activity or even trekking or something like that, then also they will be able to do it. So any we I don't think we have any other questions, and we have completed the time that we had for this meeting. Do you have anything else that you want to say, Dr. Kushbu?
No, that's what I would say. The good movement is the, like, the foundation of the pain-free life. So learn the better quality and the movement better. It's not about how many repetitions. It's not about 30, 40, 100 times you do the exercise, but how well and how right you do the exercise. That's the most important part, which gives you a lot of understanding and the awareness about your body. So yeah, that's what I would like to say.
Perfect, perfect. So anybody who is watching or anybody who is watched later, please feel free to get in touch with Optima Hospital. You can call at 998 0094600 and take an appointment with either Dr. Kushbu or Dr. Shivraj, who are the consultant physiotherapists over here. They can guide you with respect to your need for Pilates, and they can tailor a specific Pilates program for you, which can help you in recovery from any injury or any pain that you are having, but also with respect to any specific goals that you might have, like you want to do some kind of exercise or some trekking or any strenuous activity, they can help you out with respect to that as well. So with that, I think we can conclude the session. Thank you so much, Dr. Kushbu, for coming today and for helping us to discuss all this with all of the
Thank you.
patients. Thank you
Thank
so
you
much.
so much for this opportunity.